Breast Cancer Awareness Month. Professor Appelstedt and Professor Graver are joining me in studio. These two doctors are going to tell you what you should do if you've been diagnosed with breast cancer. Hello.
Hi, Jennifer.
Hi, Jennifer. How's it?
Good. How's your Breast Cancer Month going?
Busy so far.
It's usually very busy
Yeah.
because women think of their breasts, unfortunately, only in October. Whereas, for me, every month is Breast Cancer Month.
Well, we should all be thinking about breast cancer and all cancers, I think, every month, but it's a good starting point to be speaking about it more this month. Now, once someone has been diagnosed with breast cancer, they've gotten that diagnosis from their doctor, what are the next steps? What can people expect?
Okay, I think it's above all important not to panic. Because before you're diagnosed with breast cancer, it's been in your breast for a couple of years. Before we can pick it up on mammography, it's generally been there 2 to 3 years. Before you can feel a lump in your breast, it's 4 to 5 years. So whether you actually do something about it today, tomorrow, or even in 3 months, doesn't make any difference on the outcome. So after the initial shock, you can recover, which takes usually 2 to 3 days, because your mind needs to clear this information. Once it's cleared, then you can start thinking about what next to do. The best thing then to do is to look up a treatment center where there are an awful lot of breast cancers being treated, because it's a general fact of life. Like Gary Player used to say, the more I practice, the luckier I get. I say, the more breast cancer I see, the luckier my patients get. It's been shown very well that this is the single most important factor to select your treatment center properly. That has the most important effect on your outcome. It's more effective than chemotherapy, hormonal treatment, radiation, simply to select properly where you're going to go for your treatment.
How do you properly select where you're going to go?
It's actually very simple. You look for a place that sees more than 100 new cases of breast cancer per year, preferably more than 150, that runs a multidisciplinary clinic where you're being seen by a surgical oncologist, by a radiation oncologist, by a medical oncologist, and by a plastic surgeon in one go, in one meeting. That correct treatment plan can be formulated for you.
What are some of the most common misconceptions or myths that you hear as doctors when it comes to breast cancer?
I can't get it because it's not in my family. Nonsense. The other misconception is it occurs more and more in younger women. It's not true. We're a developing country, we have a young population structure. That means, obviously, we see more breast cancer in young women than elsewhere. Next is hormonal replacement therapy does give you breast cancer. It does not. It may increase very marginally the risk of breast cancer, but it will not be the cause of your breast cancer. Underwire bras is one of my favorites. It's a myth. Breast cancer has got nothing to do with underwire bras. Deodorants, we cannot kill that myth. It's got nothing to do with deodorants, no matter of which form. So these are some of the common misconceptions.
Now, what are some of our treatment options once we've been diagnosed? What should we be looking for?
Surgery is the only treatment option that offers you any form of long-term survival, any hope for long-term survival. Now, this is actually very important, and this is why Prof. Graver is sitting here next to me. He's the plastic and reconstructive surgeon that I'm working with. We have realized that with early diagnosis, with increased awareness, we see breast cancers that will be survivable for long times. Many women are. In the Western world, about 80% of patients survive their breast cancer for 20 years. In our own practice, we've had a look at it. If we screen patients in our own practice, we will discover breast cancer so early that the woman has got a normal survival. So in the old days, when we used to do mastectomies or tumor excisions, actually survival was not a consideration. It was merely controlling the cancer. But these days, survival is already conquered. We know that the women will survive a long time, and then it is not permissible to leave the woman disfigured. And Professor Graver has got the tools to actually restore the woman with breast cancer to a normal, attractive female appearance. And this is what we're doing these days. course, me as the surgical oncologist will still have to ensure your long-term survival, but the aesthetic aspect is a very important part of the psychological rehabilitation of the woman with breast cancer.